Hello Miss Go. Today my group will present about nasopharyngeal cancer. My name is FIKRIYAH binti SHAHIDIR. My number matrix is U4230273. I'm going to present about introduction of the disease. So what is nasopharyngeal cancer? It is a cancer that develops in the nasopharynx tissue in the top portion of the throat behind our nose. It is also a squamous cell carcinoma. It is a type of skin cancer that caused by an overproduction of squamous cells in your epidermis, the top layer of your skin. It starts in the flat cells lining the nasopharynx, account for the majority of nasopharyngeal malignancies. Next, epidemiology is actually a study of disease, health, and the causes of the disease in a population. So, nasopharyngeal cancer is the most frequent upper respiratory tract infections. It is actually rare globally, but has a high incidence in regions such as southern China, Malaysia, and part of North Africa. Next, etiology. Etiology is the causes of the disease. First is infectious causes. It comes from the virus such as rhinovirus and Epstein-Barr virus. It is also come from bacteria such as Streptococcus pyogenes. Other than that, it also come from environmental exposure such as exposure to smoke, dust, or allergens. Last, it comes from genetic and dietary factors. It is particularly in naropharyngeal carcinoma, NPC, where the salted fish consumption and Epstein-Barr virus (EBV) infection are implicated. Pathophysiology is a study of abnormal changes in a body function that caused by a disease. Pathophysiology for nasopharyngeal cancer is an infection that leads to mucosal inflammation, congestion, and immune activation. Also, a chronic exposure to carcinogens or Epstein-Barr virus (EBV) infection may induce epithelial dysplasia and malignant transformation. Clinical significance. This disease can affect breathing, hearing, and quality life for an individual. While most infections can resolve by their own, those conditions like nasopharyngeal carcinoma require early detection and aggressive treatment due to their own potential for local invasion and metastasis. Public health relevance. The prevalence and potential for complication is high. These diseases are major focus in ENT, ear, nose, and throat, practice, and public health.
Hi, my name is BINTI GHAZALI. My number matrix U4230276. Today, I would like to explain about sign and symptom nasopharyngeal cancer. What is sign? Sign is a warning to get a nasopharyngeal cancer, such as hearing loss, stuffy nose, nosebleed, ear infection, a feeling of fullness in ears. The symptom is can notice nasopharyngeal cancer, notice a lump on the back of their neck. There may be one or multiple lumps, and they are usually not painful. These masses appear when cancer spread to the lymph nodes in your neck and it causes them to swell. Many nasopharyngeal cancer symptoms are like symptoms of either a serious illness. Having one or more of these symptoms doesn't mean you have a nasopharyngeal cancer. Thank you.
Hi, my name is HANNAN binti AHMAD SHUKRI, matrix number U4230324, and now I'm going to explain about the medication. Cisplatin is the most commonly used medication to treat nasopharyngeal cancer. Cisplatin is a cornerstone chemotherapy drug used to treat nasopharyngeal cancer, which is NPC, especially in locally advanced stages.
Hi, my name is FAZIRA binti SHIRA DHARAN. My metric number is U423039. Now let's talk about the mechanism of action. This drug is an alkylating like cytotoxic agent. It's enters the cancer cells and becomes activated in aqueous or watery environments. Once activated, it binds to the DNA, especially at the guanine bases at the N7 positions. This binding causes DNA crosslinks, both intra-strand and inter-strands. Because of these crosslinks, the DNA cannot replicate or transcribe properly. This leads to cell cycle arrest, and finally it induces apoptosis, which means programmed cells death.
Hi, my name is NURAINI binti MUSA. My metric number U423031. I will explain about the adverse reaction for cisplatin. Cisplatin can cause several serious side effects such as severe nausea and vomiting. It may damage the kidney, bone marrow, and ears. Electrolytes imbalance like low magnesium and calcium levels can also occur. Other effects include nerve problems, seizures, and hearing loss, especially in children. And that's all from me. Thank you.
And now I will explain about the treatment. For the treatment, I choose radiotherapy, which is RT. It is a primary treatment for early stage NPC, which is nasopharyngeal cancer, stage 1. Uses intensity modulated radiation therapy, IMRT, to target the tumor while sparing healthy tissue. It's often combined with chemotherapy in advanced stages. How radiotherapy works. High energy radiation like X-rays or proton beams is directed at cancer cells. It damages the DNA of cancer cells, preventing them from growing or dividing. Then, cancer cells continue to die off for weeks or months after treatment ends. That's all.